Thank you for joining me. I'm Lori Halsey, the Director of Health Services. Here in the Independent School District, we are committed to providing a safe and healthy work environment for all of our staff. Today, I would like to share with you information about bloodborne pathogens. As a professional in the educational system, you need to be aware of the potential dangers of bloodborne pathogens. Not every staff member is occupationally exposed to bloodborne pathogens while performing their job. However, it is important for every employee to know what places them at risk for bloodborne pathogen exposure and the safety procedures to minimize that risk. Bloodborne pathogens are infectious microorganisms found in blood and other body fluids that can cause disease that are potentially serious or even fatal. Some of these include hepatitis B, hepatitis C, and HIV, the virus causing AIDS. There are many other potentially infectious materials that employees may be exposed to that could cause potentially less serious illness or infection. Some of these examples are vomit and feces. Exposure to these items does not constitute a bloodborne pathogen exposure unless they would contain blood. One may be at risk for exposure to bloodborne pathogens or other potentially infectious material while performing job tasks, such as providing first aid for someone with an injury, cleaning up after an injury or accident, while diapering or assisting a student with toileting needs, bites, breaking the skin, blood that could be spit or splashed on an employee. Employees could encounter a finger stick. We would consider a direct exposure to a bloodborne pathogen to be a needle stick from a used needle, or a cut to the skin from a sharp object that has blood on the object. However, an employee can have an indirect exposure to a bloodborne pathogen. This would occur when blood or other potentially infectious materials come in contact with the employee's skin that is not intact or with the mucous membranes of the eyes, nose, or mouth. The Independent School District has an exposure control plan in place to help maintain the health and safety of all staff. This exposure control plan can be found in its entirety in the Independent School District Employee Handbook. Employees who have occupational exposure to blood or other potentially infectious material that contain bloodborne pathogens that may cause illnesses like hepatitis B, hepatitis C, or HIV must comply with the procedures and work practices outlined in the exposure control plan. To ensure employee health and safety, please use universal precautions when there is a potential to have exposure to blood or other potentially infectious material. Always consider blood and body fluid to be infectious and take the needed precautions in every situation. Encourage students to apply pressure themselves when bleeding. In a situation where a student has had a bowel or bladder incontinence, encourage them to provide self-care, offering them the needed supplies. Staff will observe and encourage diabetic students to perform their own diabetic care to the best of their ability, providing assistance when needed. Employees will wear gloves when working with students when there is a chance to have contact with blood or other potentially infectious material. When cleaning blood, vomit, or other potentially infectious material, employees will wear gloves and clean with the appropriate cleaning agent provided by the building. Employees must wash their hands after removing protective gloves. If an employee encounters an exposure, as soon as possible after that exposure, wash the skin or flush the mucous membranes. Blood-stained clothing will be changed if unable to be cleaned. Broken glass should be picked up, not with your hands, but with a broom or a vacuum. Contaminated needles and other contaminated sharps will be discarded in a sharps container in the school nurse's office immediately after use. Never bend or recap needles. Sharps containers are puncture resistant and leak proof, ensuring the safety of students and staff. Nurses will provide building staff with a kit to use in emergencies. The kit will contain gloves and Band-Aids. If you did not receive a kit or need replacement supplies, please contact your building nurse. Facilities staff will receive gloves from their supervisor. All work surfaces that become contaminated with blood or other potentially infectious material will be cleaned as soon as possible with appropriate cleaning supplies. Buildings will be routinely cleaned and decontaminated. Disposable non-latex gloves will be worn when it is reasonably anticipated that the employee will have hand contact with blood or other potentially infectious materials. Contaminated gloves will be removed and disposed of in a lined trash can. Then the employee will immediately wash their hands. Never reuse gloves, and be sure to replace gloves when they become contaminated, torn, punctured, or they are no longer able to function as a barrier. Gloves should be worn anytime there is a potential for you to come in contact with a bloodborne pathogen or other potentially infectious material. When you are done with the situation and it's time to remove your gloves, you're going to pinch at the wrist, gently pulling away from your body from the wrist down to the fingertips, pulling the glove inside out. Wad the glove up inside of your gloved hand. And then carefully, not to touch the outside of your glove, place 2 fingers inside of the glove. Gently pulling away from your body, pull the glove inside of itself. You've created a ball now where the inside of the gloves are inside of each other, and yet this time you're going to dispose of the gloves in a lined trash can and immediately wash your hands, being careful not to touch any surfaces. It is considered an exposure incident when direct or indirect transmission of blood or other potentially infectious material that may contain bloodborne pathogens comes in contact with the mucous membranes or non-intact skin of the employee. For the purpose of the exposure control plan, it is not considered an exposure incident when coming into contact with other potentially infectious material that do not have the potential to contain bloodborne pathogens. Immediate first aid is needed after an exposure to blood or other potentially infectious materials that could contain a bloodborne pathogen. The employee will wash the exposed area thoroughly with soap and water. If the mucous membranes are exposed, flush the affected area with water as soon as possible. Employees will immediately report the injury to the school nurse and his or her supervisor. If the immediate supervisor is not available, the employee will report to another school administrator. If the employee experiences an exposure incident, the employee will be offered a post-exposure evaluation and follow-up. The school nurse will arrange for the medical post-exposure evaluation following the workers' compensation process. The school nurse will assist the employee in completing the needed forms. Outside of nurse hours, the supervisor will complete the workers' compensation referral process. The independent school district, employee, health clinic, or other workers' compensation agency will consult with the employee regarding workers' compensation treatment, information about bloodborne pathogens, and instructions for follow-up will be given to the employee at that time. They will also discuss with the employee the option of blood collection and testing. In the event of an accident or injury involving blood or other potentially infectious material with the potential to contain bloodborne pathogens, do not attempt to clean up blood or body fluids without gloves and proper training and the proper cleaning supplies. Contact the building nurse to care for the student's medical needs, and contact the custodial services to clean up the area. Please contact the building nurse or myself, the Director of Health Services, with questions regarding bloodborne pathogens and other potentially infectious material.